Kung tayo'y matanda na. Hala, hindi ako singer, mga mommies and daddies, pero pwede niyo akong sabayan later, ha? So, just like us po, ang mga anak natin na dating tinatawag na special child ay tatanda rin. Parang tayo, magiging adult, magiging senior citizen. So, kailangan din pong paghandaan ang mga health issues nila among other things. So, welcome po sa April episode ng AOK Pilipinas. Nagsa-celebrate po tayo this month ng ating World Autism Acceptance Month. So let's continue po to appreciate ang mga taong nasa autism spectrum. Ako po si Dang Koe, nagsisilbing magandang chair emerita ng Autism Society Philippines. Kagaya po ng paulit-ulit na sinasabi ko, huwag po tayo mag-expect ng mga lecture. Palagi pong kwentuhan. Yun po yung sinasabi namin palagi sa ating mga guests. At higit po sa lahat, huwag po tayong maging judgmental sa mga questions ng ating kasamang nanonood para naman po mas matulungan natin ang mga taong nasa spectrum at ang mga pamilyang nagmamahal sa kanila, whether sila ay nag-uumpisa pa lang ng kanilang journey or, yes, adult na ang ating mga anak. Okay? At dahil po ito ang World Autism Acceptance Month, we have invited as our co-hosts ang isang napaka-active na member ng ASP Self-Advocate Circle who was an officer for the ASP Self-Advocate Circles from 2018 to 2024 at kasali po siya sa Policy Development Team ng ASP. Okay. Sa ngayon po, she works as a junior graphic designer for a local creative consultancy firm for almost 2 years. Di ba nakakatuwa? Na-employ po sila, pwedeng-pwede. Nanalo pa po siya ng Miss Possibilities in 2018 and in 2019, siya po ay recipient ng ASP's Autism Angel Achievement Award or 5A. Ayan. Pasok, Pia.
Good morning, Mama Dang. Hello po sa mga viewers natin from Luzon, Visayas, and Mindanao. Uy, and we also have viewers from our kababayan based outside the Philippines.
Yes.
Hi, Tita Dang. Kumusta?
Hello,
Kumusta na
Pia.
ka naman po?
Nakakatuwa naman. So you've been employed for 2 years.
Yeah, almost 2 years, in fact. I'm going to be celebrating my second anniversary come June. So it's going to be a wonderful opportunity.
Sa company, meron bang health plan?
Oh yeah, we do have a health plan. We have HMO services, and we also have dental cards issued by a health service provider. And we also do have our annual physical exams, and I also plan to do some doctor's appointments within the year. I mean, kailangan talaga gamitin yung healthcare, di ba?
Yes, at mamaya, yan ang pag-uusapan natin. Okay?
Yeah, I would like to learn more about this. Like, it would be very interesting to know.
Go, Pia.
Okay. First of all, we would like to thank our ASP partners, respected professionals, and institutions who support our AOK live web show. The Philippine Society of Developmental and Behavioral Pediatrics, Neuroscience Division of the Philippine Children's Medical Center, Ateneo Autism Study Group, and Smart Parenting.
Okay.
So, who is our guest for today, Tita Dang?
Ako, Pia, at sa atin pong mga ka-chat na nanonood, medyo konting tayo ngayon, nosebleed. Okay? Kasi po, imported ang ating guest. And while he's a Filipino, doon na po kasi siya lumaki, nanirahan sa US. Kaya today po, ang mga questions natin sa kanya ay English. Ay, hindi po. Oh, yes, English. Sasagutin po niya ng English. From time to time po, sisingitan po siya ng Taglish. Subukan natin kung kabisado pa niya. Okay. So, ang guest po natin is a board-certified family medicine physician based in New York. Okay. 20 years of experience na dinedicate po niya ang career niya to caring for those with intellectual and developmental disabilities as a clinician, educator, and administrator. So, napunta po yung linya ng pagka-doktor niya. Assistant professor po siya sa Department ng Family Medicine and Pediatrics at the Albert Einstein College of Medicine. At siya rin po ang director ng primary care at the Rose F. Kennedy Children's Evaluation and Rehabilitation Center sa ginugal ko po ang pronunciation nito, Montefiore. Montefiore Medical Center. And he is also a board member at the American Academy of Developmental Medicine and Dentistry. So, ngayon ko lang po na-realize, meron palang ganon yung doctor na nag-specialize dun sa intellectual and developmental disability. So let's welcome Dr. Vincent Siasoco or Doc Vinny.
Hello, good morning. Thank you for having me here.
Hello,
Good morning.
Yeah.
Good morning
Oh.
here, and of course, good evening to you.
Yes. Para po sa ating mga ka-chap, kung mapapansin nyo, ang family name ni Doc Vinny ay Siasoco. So alam po niyo kung kanino related? Okay. Related po siya sa ASP Antipolo Chapter President. Si Daddy Dindo. Daddy Dindo, shout out. At dito na, salamat sa pagdadala mo sa atin kay Doc Vinny. So, Doc Vinny, okay. What time is it in the US? In New York?
It's about 10 after
Ah.
in the evening. So yeah.
Then in the evening, so
In the
definitely a pleasant evening to you.
Yes. Okay. Let's start the questions because later on there will be more questions online aside from those we prepared for you. But first, last time you visited the Philippines, no? And we even met. So, would like to know what brought you back to the Philippines then, and why did you get involved with the sector of persons with disabilities, not just autism?
Sure. So I'm a first generation Filipino. I was born, raised, and still live in New York, but I went to medical school at the University of Santo Tomas. So I'm a proud Tomasian graduate. So I had first gotten involved with individuals with intellectual and developmental disabilities in my earliest stages in high school and college. I volunteered as a coach for the Special Olympics, which is an organization that provides sporting events, exercise for individuals with disabilities. I also worked in group homes where I oversaw the care of individuals with developmental disabilities during my college years. Here in the States, we do a lot of volunteerism. So I volunteered at a lot of different organizations that cared for this patient population. And I just fell in love with the population. I knew that it was a population that I wanted to take care of and focus my career on. So when I went to medical school in the Philippines at University of Santo Tomas, I got a wonderful education and met wonderful physicians and had wonderful classmates. And the experience I had in the Philippines was just, it was amazing. I really appreciated it and I look fondly back on it. One of the things that I did notice was when I came to the Philippines, I was always inquiring, maybe was there a way I could volunteer at maybe some organizations that cared for people with disabilities and learn how to take care of somebody with autism or Down syndrome or cerebral palsy while I was a medical student. And I quickly realized that unfortunately, as a medical student, there's not much training on how to take care of this patient population. So after graduation, I went back to the States and completed my residency in family medicine. And again, tried to get involved with the disabled population and come to find out in residency training, there's not much opportunities to learn about the population as well. So I was fortunate enough after residency to work at an NGO where they provided services for this patient population. So moving forward 20, 25 years later, I've still been working with the population, as Dang had said, not only as a clinician, but also as an educator, teaching at the Albert Einstein College of Medicine and giving lectures wherever anybody would have me, and also overseeing different NGOs and working in different organizations that care for this population, but also volunteering wherever I can, which brought me back to the Philippines and connected me with Special Olympics Pilipinas. I started coming back to the Philippines more frequently about 2022, and realized with the experience I have, it was about time that I also give back. And that's how I started to get more connected with the Philippines and learn about the healthcare system that I've been away from for so long, and learn about the population, what the needs are, what the challenges are, and where maybe I could provide assistance and support to anyone or any organization that may need it.
Oh, okay, you sounded so passionate, and it really seemed that yeah, it's in your heart from the early years down to up to present. No, your cousin Daddy Dindo is already online watching you. Hello, Daddy Dindo. Okay, and just a reaction to what you said. I was telling myself, sana all about the group homes. Okay, Pia, your
Okay.
question.
Oh, I really appreciate how you explain about your journey towards becoming more involved with the disabled population. And I really like how your heart is so into it that you really want to discover more of what people like me are handling, especially in regards to healthcare. And with that in mind, in your practice with adults on the spectrum like me, what are some of the common conditions or health concerns you have encountered through the years?
Right. So, in there's certain common co-occurring conditions in individuals with intellectual disabilities, autism, cerebral palsy, Down syndrome. So, for example, we see a lot of gastrointestinal conditions like reflux disease, constipation. That's a big issue. We also see, unfortunately, neurological conditions such as seizure disorder, epilepsy, issues such as allergies, sleep difficulties. We also see mental health and behavioral health issues, such as anxiety, impulse control disorder, depression, even. That's a concern that we see with the individuals that we take care of. But we also see those conditions that anybody would deal with. For example, diabetes, hypertension, high cholesterol. I see that in a lot of our adult patients that we take care of at our clinics. So we want to make sure that any conditions that are seen more commonly in individuals with intellectual disabilities are also taken into consideration what the non-disabled population would also have to deal with.
Okay,
It's very
so
interesting to hear about all of these because hear a lot of health issues that fellow adults on the spectrum face, especially when it comes to mental health concerns and other internal organ issues. So it's really interesting to see all of these laid out.
yes.
What about you,
So
Tita Dang? Have you noticed these things also happening to the people you know?
I'm sorry, Pia. I didn't get that.
Oh, I was asking if you've also seen these kinds of health concerns within your relatives or the other people you know who are on the spectrum.
Some. I've seen some, but I'd rather have the doctor explain them later with me. Okay, so
Ah,
because I
okay.
don't want to mention names, okay? So, okay, but I'll proceed to the next question, Doc and Pia. Should we call you Doc, Doc Pini, or Doc? Okay, Doc na lang, for short, because
That's
all
fine.
our guests, we call them teachers, teach, or Doc. Okay, so we know, I'm pretty sure by now, after your explanation, that it is important, to transition to adult health care for persons with autism. And when do you think should caregivers like us start to plan for adult health care?
Here in the States, when we talk about transitioning from pediatrics to the adult healthcare world, transition discussions can start as early as 16 or 17 years old. The earlier you have a discussion, the better it is because at least you can plan ahead. The more planning ahead, the more early thinking about what's to come as that child turns into an adolescent and turns into adult, the earlier you plan, the better. So there's no exact age or year in which to start thinking about transition, but always keep in mind individuals with autism are going to get older. Their bodies are going to get older. They're not going to be children. They're not going to be adolescents, and their parents will get older as well. So when that child with autism becomes 30, 40, or 50 years old, their bodies get older as well. And as their bodies get older, they also come with certain health conditions that have to be screened for, managed, and treated if they're diagnosed. So when we talk about transition, the earlier you think about transition and what changes will come, for example, after they finish school, after they finish high school, what are the plans? Will they go into college? Will they work? Will they be at home? Who will take care of them? So transition really starts at the earliest age possible, around adolescence. Again, as the bodies age, so do the medical conditions too.
So, thank you, Doc. So, mga mommies and daddies, ewan ko about you, no? Pero, di ba minsan, akala natin because special child, no? So, we're so busy addressing yung iba nilang concerns. Pero, yun nga, just like us, tatanda tayo, ako matanda na, no? And there will be health issues, no? So, minsan, lalo na for some of us, hindi tayo masyadong health conscious. Ako, sa totoo lang, I don't I don't have regular checkup, no? Pero we have to be more purposeful, no? Mas talagang consciously pinaplano para sa ating mga anak, lalo na if they cannot tell us, no? Like ang anak ko, hindi niya masasabi sa akin what he's feeling, no? He's now 31 years old. So ang sinasabi lang ni Vince, if pinagpaplanuhan natin paano pag-transition to adulthood, to employment, kasama ang healthcare. Thank you, Doc.
And and that's true because I also admit, as a person on the autism spectrum myself, I tend to be forgetful about approaching my health concerns, and it's something that I really have to be more aware of, especially as I'm growing older. And sometimes and I also have like carried some conditions that are common in the family, so it's really important to be very aware. And with this in mind, Doc Vince, what advice would you give to to parents of children and adults with autism who are getting older or already adults about their healthcare?
Well, I think when I talk to parents of children or adolescents with autism, I tell the parents to think about their own conditions, about their own health care and where they're at. In the Philippines, much like in the States, there's a rising number of individuals that are getting diabetes, that are getting high blood pressure, or having cholesterol issues. So when I talk to families, I tell them, think about your own health conditions, where you're at. And are you taking any medications? Were you diagnosed? What are you doing for your own health and wellness? And think about your own children, because sometimes the children won't be able to tell you how they're feeling, or won't be able to advocate for themselves. So that's where the families have to understand, here's my medical conditions, and if it runs in the family, my child may be at risk for getting it too. So that's where they may need to go get screened, see a provider. I know it's not easy to find a provider that takes care of individuals with autism, but it's very important to at least to ask around, to get that screening test, to make sure that, for example, if there's an individual that's an adult, maybe they're on the heavy side, if some of the family members have diabetes, again, there's a high risk that this individual may have it. So you want to screen for them. Even though they look okay and they're not complaining, you always want to be preventative in nature and get them screened and tested and checked out, and have regular meetings with their physicians.
Oh, okay.
Oh, that is very solid advice. I feel like a lot of parents here would relate to the need to be very conscious about health, especially for their children. And it's also something that we self advocates have to keep in mind then, because some of us have jobs and we also need to be aware of our healthcare, knowing that me and Tita Dang, when we discussed about my healthcare provisions for my company, that's a very great benefit, and I really hope that is being taken advantage of, isn't it, Tita Dang?
Yes. Yeah, and Doc, let me just shout out to our viewers. Okay,
Ooh.
mga ka-chat, baka po nahihiya kayo magtanong dahil nag-i-English kami dito. Please, pwede po kayo magtanong in Tagalog, okay, or Taglish, bahala na kami. Kasi usually, Doc, by this time, questions would already be pouring in. So I think baka po akala ng ating viewers, they have to ask questions in English. Pwede po tayo magtagalog. Okay,
Yeah, yeah.
so for my next question is, medyo seryoso tayo, from the family. Okay, let's go higher. And again, some of this, pwedeng sabihin na naman natin, parang wish list na naman. Wala naman yan sa Pilipinas. But let's ask, no? At para naman may matutunan tayo and maybe we can include them when we do our programs and services. Okay, so on top, here's a question. No? Actually, can I ask the three questions together? I have follow-up questions. Okay. So, given the challenges to access affordable healthcare in the Philippines, yan, what steps can be taken to improve the situation? I'm not, it's okay, you can answer as an individual here, but maybe to answer this, you can cite any existing framework or model in other countries like the US that the Philippines can adapt to enhance adult health care for individuals with developmental disabilities, no? Like our children. And maybe I'll ask another question after you answer those two questions.
Right. So, how do we improve healthcare in the Philippines? How do we improve access to healthcare? Well, I think it starts with education and training for the healthcare providers. I think it starts with the medical students, the dental students, the nursing students. I think there has to be an opportunity for them to learn about how to take care of somebody with autism. I think that's very important. Education and training from the earliest moments, that's important. Whether the student is in college and wants to go into nursing or dental or medical school, I think the earlier the education and awareness that they can get, the better. But definitely when they get into the medical school, dental, nursing schools, optometry schools, physical therapy schools, learn about the patient population, not only in the classrooms, but also in the clinical setting, so they know how to take care of this patient population. And that will definitely help improve access to care, because now you have healthcare providers that are trained, they understand the patient population, they're not scared, they're not apprehensive, they would have more empathy. So I think including education and training in schools at the youngest age during their healthcare professions as they move on into their careers. I think that's very valuable, and that's from the healthcare end. That's from the medical, dental, nursing end. Parents, I think they should also, again, as I mentioned, understand their own health conditions, but also set an example too, right? So there are some families that are fortunate to have insurance, so they can go to a physician or a clinician. There's public hospitals too. So I think the parents also have to set the example to take care of themselves. So if they get their routine checkups, if they watch their diets and ensure that they're living healthy lifestyles and they're exercising and they're going to their doctors for regular checkups, they set the example for their children to see what needs to be done. So I think it's not always easy. Of course, the more support the government can provide, the better. But I also think it's good for families to know what other organizations are out there. I was fortunate connecting with my cousin Dindo, who told me all about ASP and heard about all the wonderful events that they put together. But as I mentioned, I was a coach for the Special Olympics. I'm also a clinical director for Special Olympics now. I was fortunate enough to connect with Special Olympics Pilipinas and then have been very involved with their events. And when I think about these wonderful organizations in the Philippines, it's an opportunity for families and individuals to take advantage of each of the different organizations' activities, which for the most part are free. So if you're part of ASP, then Special Olympics Pilipinas or the Down Syndrome Society, it's good to understand what other organizations are and what events and what activities individuals can get involved in. And that helps with healthcare because it promotes exercise, it promotes socialization, inclusion, better mental health, not so much being isolated, but being involved with your community. So anything to get active, to maintain healthy lifestyles, to get exercise is so important. I think the Philippines is not alone in trying to improve access to healthcare. for individuals with autism and intellectual disabilities, there's not one model per se, because of course the supports are different. I'm based in New York, so our model of care is different. We have different insurances. We have a different governing agency that oversees the services here. So is it perfect here? Not necessarily. But I think there are things that the Philippines can take away from other parts of New York, the United States, and even other countries. But I think it's a matter of communication and coordinating. And I think getting the right people to the table to discuss that and see what can be possible so that it can be implemented and spread out across the Philippines.
Okay, talking about the health insurance, no? Because I've seen some comments asking about do we have insurance companies addressing this? Would you like to expound a little on the insurance coverage of persons with disabilities in your country?
Right. So here I'm in New York. So the NGOs that I oversee, at Montefiore, so the clinics that we see are adults with intellectual development disabilities. Um, Almost all of them have insurance, what's called Medicare or Medicaid, and that pays for the services. But we also have individuals and families that are maybe new to the country. They have no insurance, or they're unfortunately in a situation where their financial means are not available. So here in the States, we are able to find clinics like free hospitals, public hospitals, where we can provide those services. So in New York, a lot of the individuals will, for example, may access Medicaid. And through the Medicaid insurance, they can avail of other services, physical therapy, occupational therapy, any other services that they need. Will also help them to get into group homes if needed and get involved in day programs. We also have private insurance, which will help support the families for the individuals can get the services that they need.
Okay. I think I saw some comments asking about this insurance. Please email autismfields@gmail.com and we'll try to collate the answers to that so that we won't be seen as endorsing a particular company. No? Okay, so before I turn over the question asking to Pia, my last follow-up question. How can healthcare providers be trained to better understand and accommodate the needs of adults with autism on the autism spectrum?
Okay, be better trained. So I think there's different levels. When I think about healthcare providers, I think of healthcare providers as students that are learning to become that healthcare provider. I'm thinking of residents. I'm thinking of fellows. All of them are still in training to become that physician, that dentist, that nurse. I think those folks, I think, again, as I mentioned before, education. If there's an opportunity for them to get a lecture, to attend maybe even some type of ASP event where they can see individuals with intellectual and developmental disabilities, just get that exposure, be able to talk to an individual with an intellectual disability. There's some students, even on my own end, that have never met somebody with autism or never met somebody with Down syndrome or cerebral palsy. Sometimes the first thing is the introduction. Just meeting somebody with a disability helps a lot. On my end here in New York, I'm involved with Special Olympics. So we have events about 2 or 3 times a year where I have volunteers from medical schools, nursing schools, dental schools volunteer with me at a Special Olympics event. And we will provide free health screenings. We will provide free blood pressure screenings, dental screenings, what have you. And these are all just volunteers. They're not treating, they're not managing, there's no quiz, there's no test. The purpose for me, from my end, is I just want them to meet the athletes. I just want them to meet one person with autism, one person with Down syndrome, and get comfortable with that patient population. So if the opportunity comes around that if they're in a classroom or if they're in a residency and they're doing a rotation at a clinic that has somebody with cerebral palsy, they're coming they come in a wheelchair, that student, that resident volunteer will feel comfortable and also be more empathetic and be more curious and inquisitive to learn more about the individual so they'll learn more. So I think wherever we can, we need to provide education to students, residents, and fellows, but also those that are already practicing. I can't tell you enough physicians and dentists who are wonderful, but aren't comfortable taking care of this population. So I think everybody has room to learn, expand their mind, and be open and empathetic. So regardless of where you're at in your career, whether you're a student or you've been working for 20, 25 years, there's always room to grow and learn. So wherever we can provide education and training, so much the better.
Yes, I think I'll go back to the board and throw those ideas when it comes to the healthcare. No? I do remember there was a clinic and at least one hospital who asked how to handle children on the spectrum getting their not just the regular checkup like doing the MRI, like those stuff. No, sorry, ECG, I think, and EEG. Okay, so which is quite traumatic for some of our kids. Now, Pia?
Oh, I think it's really interesting to hear about perspectives on healthcare, on insurance, as well as the need to educate these people about approaching healthcare. And it's really nice that you also tend to be very interdisciplinary about that. You think about the healthcare providers, you also think about the population themselves and how they approach these health concerns. And one thing that I would like to stress that is important to us to discuss is the matters regarding sexual health and reproductive health, because these tend to be under discussed by many families, especially here in the Philippines. And I really would like to ask this perspective, and this was sent by a parent of an adult on the spectrum. Is masturbation an acceptable healthcare coping mechanism for adults on the spectrum?
So, that topic is a very sensitive topic, obviously. So whether it's acceptable, it's a part of human nature. What's important about that is that the family, the physician, the clinician, make sure that the individual understands what it means to do that. If that happens, that happens. It's not bad. It's part of human nature. But there's a right time and wrong time, obviously, to do that. So I think there has to be some conversation for sure, some respectfulness, some gentleness, obviously, when you approach that topic. Again, every family will have to deal with that in one way or another. But it's a conversation, and it's something that the individual will have to understand in regards to addressing that and what's right and what's wrong.
Do you have any reaction to that, Pia?
I feel like it's very I feel like this is a pretty sufficient answer, considering it's these kinds of discussions that are important to have, because a lot of people on the spectrum, they would be exposed to matters regarding sexual health, and it's really important to have these conversations and not to keep these in the dark, because a lot of us, we would be handling a lot of these feelings, a lot of these actions in order to cope with our health and our desires, and it's really something to manage that needs to be further discussed, especially in the Philippine context. So it's really nice that we are opening a discussion to in regards to this kinds of matters, since it's very normal for people to like masturbate, for instance.
Right.
So
Well,
yeah,
I
what
think
about your perspective?
I think
Yes, sorry.
sexual health is an important topic, right? The importance of having healthy relationships, right? Be it with yourself or others. So
That's
that's a very
true.
important topic because you also want to enlighten the individual to ensure that they take care of themselves also, right? But unfortunately, bad things can happen. So when you talk about sexual health and reproductive health, it is a very important topic, much like it is here, because we also want to protect our loved ones, right? So we want to make sure they know what's the best for them as well. So that's a very important topic, and it's a topic that can be very sensitive, and people may not feel comfortable, but it's very important to for families to have that conversation with their physician and loved one.
I'd like to add to that, okay, since we're at this topic. If a woman on the spectrum got pregnant, is there a uh, special consideration when taking care of her during pregnancy, like consulting a psychologist, a psychiatrist? I'm not sure. I haven't encountered such, but just
Right.
occurred to me. Mm.
Well, if you've met one person with autism, you've met one person with autism, right? So it's hard to say, what would you do? So if somebody got pregnant, obviously the medical care is the same. It's no different. But obviously there has to be some consideration taken in regards to what other aspects of the pregnancy they'll have to deal with, right? For example, the behavioral issues, the mental issues, the stress. What kind of support does that individual have during the pregnancy? Do they have family support? Do they not have family support? So I think there's a lot of factors to look at that type of patient that may be pregnant, and that happens from time to time, and you also want to look at it as a blessing, but you also want to make sure that the individual is taken care of, but as also the baby, not only during the pregnancy, but when the baby's born. So in my experience, it's a matter of when that's happened, it like with anything, it takes a village, and we need to make sure that the individual has enough support, not only with family, but physicians, therapists if needed, and any other supports that they may have. I think one thing that's important is to, if the individual can let feel comfortable talking about what their needs are. If they're not verbal, then it's something where the family can advocate what the needs may be. In my experience as a physician, especially if the individual may be nonverbal, I learned just as much from the family in terms of what the needs are for the individual. So that's where the families need to speak up. They need to advocate, um, and talk to the physician and let them know what they're concerned about and what needs that the individual may have.
Okay, it's very important to have these, and I really appreciate your points on that, considering that various autistic people would deal with a lot of these issues, and it's also important to be aware and understanding on how to manage these. And it's still in relation towards reproductive health. There is a question that is sent in by a viewer that is wondering if circumcision is necessary for males, because there are people who would decide to have that procedure done to their children, but is it truly necessary?
I I think that's I think that's a personal decision. Here in the States, some people get it. Whether it's necessary, I think that's really up to the family to make that decision whether it's important for them to have it or not.
Okay.
Okay,
Um,
very
thank you,
much
Doc.
appreciated for that.
We have a question here, but I'm not sure if we should address this to Doc Billy, because the mom or the dad is asking that, knowing that we already have a shortage of developmental pediatricians, what about doctors for adults on the spectrum for checkup? So in other words, specializing on adult autism health issues. So I'm not sure if because I think she's asking about the Philippine situation. Do we have doctors like you? We have doctors like you who is specializing on seeing people with developmental disabilities. So, would you like to comment on that?
So I'm sure there are. I don't obviously I don't know anybody. I don't know. I'm sure there are, but maybe not to the depth that I've been involved in. But again, that it's hard for me to say. When I look at, so I'm a family medicine physician. So when I think about primary care, family medicine, I've always been trained. Whoever comes into my exam room, I should feel comfortable enough to take care of them. And I think sometimes that's just the first step in trying to find a uh, family physician, a pediatrician, an internist that is not a developmental pediatrician to say, would you be able to take care of my child, my adolescent, or my adult with disabilities? Because as I mentioned from the start, there is no training in medical school or residency on how to take care of the patient population. Um, in my journey, I kind of had to find my own way. I had to find those doctors, those nurses, that dentist that took care of this patient population, and it wasn't easy. It took time. So I was very fortunate to have mentors that supported me. But a majority of physicians out there don't have that, and that doesn't mean that they don't want to take care of the population. They just may not know how to. They may not feel comfortable. But I think they should be given the opportunity, and I think that's a conversation that should be had. But where are the adult physicians, family physicians in the Philippines? Hard for me to say. I guess in my journey over the last few years, getting to learn more about the Philippines again and the healthcare and how people with disabilities are taken care of, I've gone around and spoken with family physicians, and I always ask them, would you be willing to take care of somebody with autism if they came into your exam room, or cerebral palsy or Down syndrome? And I don't have many that would say no. So I think there's still a good opportunity. I know there's a good opportunity to raise awareness and get doctors to feel comfortable about taking care of adults with disabilities.
Oh, yeah.
May I have a word on this too? I
Okay.
feel like it's also important that doctors would have to be prepared to face people on the spectrum who are handling health concerns, and to be very empathetic as possible. Because of course, we have been reading various experiences from people on the spectrum who felt like there are doctors that they attend to that don't tend to be quite considerate with their needs, so they still undergo a trial and error process to find the doctor that fits their needs very well. So I feel like, but it's also important for doctors in general to have a very considerate perspective towards these people, and I really hope we see more of that here. And thanks for the insight, Doc Vince, about it.
So
So
let
now,
me Yes, let me just address this to my mommies and daddies on the audience. So I guess maaring wala pa tayong ganong listahan ng mga doctors like Doc Vince. But just like tatanda ako when Gio was still a young boy, hanapan ko siya ng dentist. So wala naman tayong mahahanap ng dentist na may nakalagay na 4 children on the spectrum. We really have to find someone na madaling pagpaliwanagan at willing na i-accommodate yung mga anak natin. So hopefully, we can join together and come up with a list of these doctors, dentists, and others para pwede pong tuwing may nagtatanong sa mga FAQs natin sa ASP, meron tayong pwedeng maitulong sa ibang kapwa magulang. Okay, so back to you, Doc. I think this will be our last question unless, there's one pa pala. But, okay, let's ask first. This question. Okay, what will happen to children on the spectrum who have received, ready? Sorry. Anong nangyayari sa bata on the spectrum kung madalas binibigyan ng anesthesia? Okay. So, Doc, so here's a child on the spectrum, and every time he goes to the dentist, no, for dental works, he would be given anesthesia. Is that okay? I don't know how often the child got the anesthesia.
Right. I think that's a big challenge. I think dental care, as a family physician, as a primary care physician, I cannot do it alone. I cannot take care of the individual by myself. I need the patient to see their dentist. They need to see their eye doctor. They need to see their specialists. So it really takes a village to take care of this population. And unfortunately, there are some situations where individuals with autism may be very apprehensive about going to the dentist, to the point where they're in absolute fear. They don't want to go into the dentist room. They don't want to sit in a dental chair. So again, it's not everybody, but there are more challenging patients than others. And I have seen that they may need a couple of visits, 2 or 3 visits to the dentist before they feel comfortable getting examined, checked out, and treated by that dentist. Others, unfortunately, frequent visits and trying to desensitize them and trying to get them comfortable sometimes doesn't work. So sedation sometimes is something that's warranted. A trip to the dentist shouldn't be every week, every month. So if it's once or twice, again, depending upon what the condition is, I've seen that too. And unfortunately, there are situations where individuals may need to get anesthesia to do a proper exam. So I can't say how often that is, but it does happen, and unfortunately, it is a reality. So, kudos to my dental colleagues that really do everything they can to take care of this patient population because it's not easy on their end either.
I see. I think it's very important to have these kinds of discussions too, in regards to facing these kinds of medical work and try to ease these people from the fears and other hesitations about it. Now, we have a question from another viewer that in your personal assessment, Doc, is the Philippine medical community ready or is willing to accept neurodiverse individuals for their patients?
So I can't speak for the entire Philippine medical community, but I would like to think so. I think you'd have to ask them directly. Are they ready to learn and open their arms and eyes and ears in terms of how to take care of this patient population? My experience at UST was a wonderful experience, and the attendings and colleagues and classmates I had were just amazing folks, and they still are. And it'd be interesting to get their take on this to see. And I think one would hope that any healthcare provider in the Philippines would be open to learning and taking care of the population.
Oh, okay. Thank you, Doc. Now, here's the last question advanced before the show. Let's check later if there are some more questions online. Okay, so you, you have to relate this to the medical angle. Okay. Are therapists still therapists? That means speech therapy, occupational therapy, behavioral therapy. Are they still necessary? Do they still work for transitioning adults on spectrum, especially those who had inconsistent therapies during their early adolescent ages? So I think what they're saying is, can they still do this speech OT, even adults, especially if they didn't have it during the early years?
Yes, absolutely. Again, depending upon what conditions that they have. So, for example, if somebody needs psychotherapy, needs to see a psychologist to address any behavioral issues, as I mentioned, anxiety, depression, that can be an ongoing issue, whether you're a child, an adolescent, or an adult. You're always going to need somebody to support you and address those needs. So, things that happen, conditions that occur as a child, as an adolescent, can carry over into adulthood. So getting that therapy is very important in adulthood as it was as a child and adolescent. Physical therapy, occupational therapy. Again, everyone's different in regards to the treatments, the conditions that they have. But I have adults that have come my way that have never had physical therapy or never had a speech therapist or never had a psychologist or a social worker work with them for counseling services because they're new to the area. They came from a place that never had that or never knew about it. So anybody can benefit from those services at any point in their life and any age across the lifespan, children,
Oh,
adolescent, or adult.
okay. Including those who are still nonverbal.
Correct. Correct. Because if they're nonverbal, they can still benefit from those services.
Um,
If they're nonverbal, they may have their own way of communicating. And again, you met one person, you've only met one person, you met one patient, you've only met one patient. So it's hard to make a generalization to say everybody's like this. So
yes. Okay. I think, there's another
Question
question.
that's
Is the, pwede ba ang clinical psychologist, doctor ang mag-assess? Okay. Is it no, is it okay if instead of a developmental pediatrician, whom they find, some families find very expensive, can a clinical psychologist assess somebody on the spectrum instead of a developmental pediatrician?
So again, that I'm going to be very careful. It really depends upon the individual. So it's hard to say, is this better or is this okay instead of this type of professional? It's hard to say yes or no because again, every individual is different. So there may be, when we're talking about an individual that's getting screened or diagnosed with a disability for the first time, the developmental pediatricians are very valuable. They're a very important service because they also work with other clinicians. So to say, would this be okay instead of this person or this profession, it's kind of hard to say. Again, it depends upon the individual. But the value of the developmental pediatrician and the psychologist are both very important.
Okay, let me just make a guess. If that parent, the viewer who asked, if the question is in relation to getting a PWD ID, no, and well, then I think I'm not sure. I'm not sure if some LGUs will accept a psychologist or a psychiatrist instead of developmental pediatricians. But I think po pwede kung ang habol lamang is for renewal or for application ng PWD ID. But what the doctor is saying, Dr. Vin is saying, is that if we want a doctor who will guide us through the developmental stages of a child on the spectrum, then mahalaga po na meron tayong kapartner na developmental pediatrician. Okay? So, I think, Doc, we finished all the questions just in time. Okay? So, okay. Pia?
Oh, of course. For all the viewers and for those who would be watching, we are going to have our Angels Walk this coming May 18, 2025 at SM MOA Arena. And we also have various Angels Walks in various chapters. So please watch that for whatever is in your location. So Angels Walk Cebu is on tomorrow at SMC Side Cebu. And also ASP Puede Colorful Twirl Crafts activity is on today, 26th of April 2025. So for those who have registered, we hope you have fun with your Puede. And if there are viewers that are interested to join succeeding Puedes, please watch out for our socials, which is available on Facebook or YouTube and other social medias. Follow Autism Phil, Autism Society PH, and remember to be updated on that. And of course, Doc Vince, we are so thankful for your presence here, and we would like to ask you if you have any final words of advice for adults on the spectrum like me and for their families in regards to adult healthcare.
I think, for those adults on spectrum, I think, I just have so much admiration for you. I think it's, you have to also be your own advocate when you can. So when you're dealing with a physician or dentist or a healthcare professional, advocate for yourself. Don't be scared. Always ask questions. The more questions you ask the provider, the better. It's important for you to be informed. For families, it's important to advocate for your children, your adolescent, and your adult child. Your 40 or 50-year-old son or daughter is always going to be your child. So it's important to advocate for them and advocate and find that doctor, find that dentist that will have the empathy to take care of your child. But again, also set the example. Take care of yourself too. I mean, take care of yourself. You see your doctor regularly. You take your medications. Again, living a healthy lifestyle, exercising, setting the example for your child, regardless of how old they are. I think that's the first step.
Thank you very much, Doc Vince. It's very important to have discussions and ideas about healthcare instilled in us, especially as people on the autism spectrum. Especially as a woman on the spectrum, sometimes it's admittedly difficult for women, even without having a diagnosis or any neurotype, to handle medical concerns, considering sometimes we may not be listened to. But hearing Doc Vince give us a very empathetic understanding of how we view health issues, especially in the lens of someone on the spectrum or other disabilities. It is very important for us to really take care of ourselves and also seek many means and methods in order to ensure that our health is being taken care of. And I really like that perspective also for the parents to also be watchful of their child's healthcare, but you also allow the agency of the child to be aware of their healthcare too. Tita Dang, do you have any other words to add here?
Oo. When Doc Bini said na dapat ang mga magulang, alagaan din natin ang sarili natin para maalagaan natin yung mga anak natin. No? Para yung sinasabi sa eroplano pag nagka-emergency, sinong unang bibigyan ng oxygen? Yung nanay muna bago niya asikasuhin yung bata. Diba? So, napaka-importante po nun. And just like in any areas, talagang kailangan pong tulong-tulong muna tayong mag-advocate. No? Makakilala tayo ng mas maraming mga doktor, mga dentista, no, na mag-aasikaso sa mga health issues ng ating mga anak kasi nga hindi sila although sabi ni Doc Vince, they will be our babies in heaven, our children forever, no? Pero lalaki po sila, tatanda po sila, magkakaroon din po sila ng health issues, no? So, sana po yung ating nagising po tayo sa mga information na binigay sa atin ni Doc Vinny. Maraming salamat po. Important ang speaker natin ngayon at ito sana yung makakabuti sa ating mga mahal sa buhay na may autism, nasa autism spectrum. So, nabanggit po ni Pia, okay, asan ba yung kamay ko? Ayan, okay, May 8 at the SM Mall of Asia Arena. Kung wala pa po kayong ticket, mag-register lang kayo online for free tickets at magugulat po kayo kung gaano kahuhusay na ang ating mga performers on the spectrum. Ang kanila pong mga katuwet ay mga celebrities. O, di ba? Para po maipakita natin kung gaano sila kagaling, kasaya, at kakulay. Magaling, masaya, makulay ang mundo ng ating mga anak on the spectrum. So salamat po sa mga nanood sa isa na namang episode ng AOK Pilipinas. Magkita po tayo sa June. Wala po tayo next month sa May because nga po lahat po tayo ay magpupunta sa SM Mall of Asia Arena para umattend ng Angels Walk. So sa pangalan po ng Autism Society Philippines, ng ating president na si LJ Sumulong, ang ating co-host na si Pia Cabanero at sa lahat po ng bumubuo ng ASP at ang ating guest, important. Mamaya bibigyan niya kami ng chocolate. Si Dr. Siasoco. Ako po si Dang Koe, nagpapaalam, ipagpatuloy po natin ang pagtanggap, pagkalinga at pagbibigay halaga sa mga Pilipino may autismo. Mabuhay po ang isang gising na yes, AOK
Okay, Pilipinas.